Of Daytime Tri-Cities is sponsored by ETSU Health. Once again, it is time to have a great conversation as part of Meet Your Provider by ETSU Health. And today I'm joined by Dr. Keith Huffaker. Doctor, thank you so much for taking some time with us today.
Glad to be here, thank you.
Let's talk about your journey through your education, your background. Tell us what brought you here to ETSU Health.
I was an accountant for a few years and didn't enjoy that. And so I ended up going to night school and eventually entered medical school here at ETSU in 1998.
Okay.
And then I went to residency in OBGYN in Knoxville 4 years later. And then 4 years after that, I went to Texas for 3 years and completed a fellowship in female pelvic medicine and reconstructive surgery, what is commonly referred to as urogynecology.
What led you down that specific path of urogynecology?
I had a strong mentor in residency. We had a good professional relationship, and I enjoyed doing what he did, and he was very instrumental in leading me down that path. And I enjoyed the reconstructive aspects of the surgeries. I enjoyed surgery in general, and had the opportunity to study with some really strong folks out in Texas, and very appreciative of that opportunity.
Your specialty, urogynecology, kind of explain that to our viewers.
We try to help women with problems with female pelvic organ prolapse. That's when female parts are dropping or falling down. Urinary issues and bowel control issues. A lot of women with what is called stress urinary incontinence, leaking with cough, laugh, sneeze, and so on. Overactive bladder problems, bowel control problems, as well as bowel and bladder emptying problems.
Let's, when we think about all of those issues, they're prevalent, and this is something that you have a lot of compassion for your patients, don't you?
What I hear, yes. What I hear from patients is that they are their lives are disrupted. They're not doing the things they want to do, and our goal is to help them get back to doing the things they want to do and get these problems hopefully behind them, or at least under some semblance of control.
All right. Let's switch gears just a little bit and get away from the professional side of things. Let's talk about your personal life. Let's talk about your family, some hobbies that you may have, some things you enjoy doing.
Been married for this is 23.
Better get that right.
Yeah, since 1996. Can't do the math real quick there, but so I guess that's 27 years. I have 2 daughters, one in college, one in high school. They have been my hobbies since they were born, and what they do is what I do. And they've both been in competitive volleyball and their various academic pursuits, and their hobbies are my hobbies.
All right, very good. Going back to the professional side of things, you said you were an accountant. That is not a normal procedure for folks that get into the medical field. Had it been in the back of your mind even when you were an accountant to get into the medical side of things?
No, I think I was like a lot of 18 to 21-year-olds. I didn't know what I wanted to do, but I knew I had to get a job, and accounting was something practical that I knew I could find a job in, and I did.
What's a normal day look like for you?
I'm usually at the hospital or my clinic sometime around 6:30, 7 o'clock, and I'm usually leaving 6:30 at night. And if I'm in the operating room, it's 3 or 4 cases a day. If I'm in clinic, it's seeing several new patients a day. I have a nurse practitioner who's incredibly helpful to our practice, and she sees a number of patients in parallel with my schedule, and from time to time and during the day I have to step over and see patients with her, but for the most part I'm seeing new patients, and then she's taking care of them in a follow-up manner.
Looking toward the future, the procedures and things that you're doing, the treatments you're doing now, are you seeing those changing and becoming more efficient, or what do you see in the future of your field?
Well, my training primarily lies in vaginal surgery, native tissue surgery. There is a push toward robotic surgery, laparoscopic surgery in our field. I am actually going through some training for robotics. I did some robotic surgery in the past, and chose to go back to primarily vaginal surgery, and I don't think I'll ever abandon that.
Right.
but I do intend to incorporate robotic surgery more and more into my practice.
Dr. Keith Huffaker, thank you so much for taking a few moments with us.
Thanks for having me.
We appreciate it. Dr. Keith Huffaker, this week's Meet Your Provider with ETSU Health.
The preceding portion of Daytime Tri-Cities was sponsored by ETSU Health.